opportunity to speak today. I'm just going to pull up my PowerPoint presentation. Wonderful. So I'm going to be covering a number of topics today. It's hard in 1 hour to sort of cover all of the benefit programs, but what I thought I would do is take you through the framework that I use when I meet with somebody who has had to stop working or has financial issues associated with whatever their diagnosis is. And that'll be a way for me to give you an introduction to the financial assistance programs in Ontario. And if you are joining us from outside of Ontario, I will cover the federal programs, and I'll, try to make sure I specify where the programs apply, and there is likely a parallel or similar type of program in your province. So it'll at least give you the information to Google to find what works for you in your province. So when I sit down with people, there are 3 key areas that I like to focus on. I start with income replacement programs. So here's somebody that potentially has to stop working for some type of medical treatment or to deal with their symptoms. What is a stream of income that can replace their either self-employment income or their workplace income? I then focus on helping them out with medical expenses. As we know, lots of expenses associated with getting ill, which can range from medication itself to parking to childcare. So a whole host of additional expenses can arise. And then if the financial situation becomes tough, you may need to focus on other areas that you're having trouble with financially, which would be things like your rent and things like your utility payments, that type of thing. So I'm going to focus on those 3 areas today. So I like to start off with the income replacement programs. So again, these are programs that people are going to access if they have to stop working due to their illness. And I divide them into what I call the grid. And the grid has 4 types of programs. Top left, you'll see our financially tested programs. And so those are the programs that before the government body even focuses on what your illness is, they want to know about your financial situation. So those are our financially tested programs. If we move to the top right, we have our contribution-based programs. So those are the programs, and these are the federal programs that'll apply all across Canada. Those are the programs when you look at your paycheck, or when you fill out your tax return if you're self-employed, that's where you're going to contribute to the programs. Then we have in the lower left workplace programs. So it may be a situation where you look in your benefits booklet and perhaps you have short-term disability, or you may have long-term disability. You may have both, or you may have neither. So those are the workplace programs. And then we'll talk a little bit about our personal resources. So things that are specific to us and our financial situation that in times of financial need we may need to access. So specifically focusing on the programs themselves that I'm going to look at today. So on the financially tested programs, we'll look at Ontario Works and Ontario Disability. And again, if you are outside of Ontario, I'm just pulling up my list, there are going to be those types of programs, a welfare social assistance type program and a companion disability program that you're going to look for if you're in another province. On the contribution-based side, we're going to look at employment insurance sickness benefits and Canada Pension Plan disability benefits. I'll talk a little bit about short-term and long-term disability as workplace programs that you may have. And then I'll talk a little bit again about the personal assets or private insurance policies that you may have. So I like to start off on the top right of my grid, and those are our contribution-based programs. And I start with employment insurance sickness benefits because that's typically the first place that somebody will start if they don't have any benefits through their workplace. So employment insurance sickness benefits are a benefit offered by our federal government. And in order to qualify for employment insurance sickness benefits, you have to be medically unable to work. And it's a very low threshold. You don't even have to name the type of illness. You just have to have your doctor certify that you're medically unable to work. You have to have worked 600 hours in the past year. So that's 600 hours where you contributed to EI through your paycheck. And then in terms of how you apply, once you stop working, you fill out a fairly straightforward online application. You're required to get a very simple medical certificate that you can find online from your doctor. And then your employer will issue a record of employment showing that you are temporarily on a leave due to illness. So those are sort of the eligibility and application requirements. And if you are approved for employment insurance sickness benefits, they pay 55% of your average weekly earnings. They max out at $638 a week, and they are taxable. So you will see if you access employment insurance sickness benefits, they're going to take a little bit of tax off of source. In terms of when you get the money, there's a 1 week waiting period where you won't be given any money. It's sort of their review time. And then you typically will receive, if all the paperwork is in order, you'll receive your first payment within about 4 weeks. But they'll pay you back to week 2 of you stopping work. And then, you know, depending on how long your doctor certifies that you'll be unable to work, employment insurance sickness benefits are available for up to 15 weeks. So that's that program. And I sort of refer to it as the federal government's short-term disability program. So now the federal government's longer-term disability program, and that's Canada Pension Plan Disability Benefits. So what I should mention, because I get this asked all the time, is this is a completely separate program from CPP retirement that you're going to get at age 65. So by accessing CPP disability, you are in no way affecting negatively the amount of money that you're going to get when you turn 65. Think of it as a separate pool of money. So eligibility requirements, it's a two-pronged test. So the very first thing that they're going to look at is how much you've contributed to CPP. And they are looking for contributions in 4 of the last 6 years. There are some exceptions to that that may apply in your circumstance. And then if you have 4 years of contributions in the past 6, then they're going to look for you to see if you meet CPP disability's definition of disability. And that they are looking for a disability, mental or physical, that is what they term severe, number 1, and prolonged, number 2. So severe means that it prevents the patient from doing any regular type of work that they would earn a living from. So not just their previous occupation, but any work that they're sort of have the skill set for. So it's got to prevent you from working. And number 2, it's they're looking for it to persist indefinitely. But the magic number they're looking for is something that's going to prevent you from working for at least 1 year. How do you apply for CPP disability? So there is an application form, a long and lengthy application form. It's available in paper. It's also available, you can do it online. And then there's also a medical report, which your doctor or a nurse practitioner can complete. And those are sent off to Service Canada. And Service Canada has a triage system. So there are what they call regular applications, and they try to get you a decision within 4 months of being filed. I know that's a long time, but they're quite backlogged right now. If your illness is one of the named grave conditions, you'll get a faster decision. It'll be a decision within 30 calendar days. It doesn't necessarily mean it's going to be a yes, an approval, but they undertake to review your application much quicker. And in terms of lung conditions that are considered grave for the purpose of that test, there's a couple of different types of pulmonary fibrosis. There's alveolitis, idiopathic interstitial pneumonia, lung cancer. So, you know, a number of different lung conditions and a host of other illnesses. And then there's a terminal application for those that have an illness with a prognosis of under 6 months, and that you would get a fast decision. It would be within 5 business days. If you are approved for CPP disability, the amount you're going to get is going to be based on how long and how much you've contributed to the program over the years. And again, I want to mention with CPP contributions, employees contribute on a paycheck. Self-employed people contribute through their tax return. So if you hit a certain threshold of income on your tax return, there's an automatic contribution to CPP. So I often will have self-employed people who don't realize, somebody else does their taxes. They don't realize they've actually been contributing to CPP. So if you ever want to check what your CPP contribution history is, or get an estimate of what you would be entitled to if you applied for CPP disability, or what you're going to get at age 65, you can always call Service Canada and ask them to send you what's called a statement of contributions. And that's something that's going to have your whole history of contributions and estimates of what you would receive for different types of CPP. So in terms of what amounts you're looking at, the average for CPP disability is about $1,000 a month. The maximum you can get, so somebody that's contributed the maximum over the maximum number of years, would get just under $1,500 a month. If you have a child under 18 or a child 18 to 24 who's in full-time school, there will be an extra $264.53 per month. So that is CPP disability. And so now I'm going to move into our top left quadrant of our grid, and start talking a little bit about Ontario Works. And again, in your province, that's going to be whatever the social assistance or welfare program is for those with emergency needs. And so the very first thing that Ontario Works, as I mentioned, is going to look at is your financial eligibility. And that's looking for two things. Number one, they want your liquid assets to be below a specified level. So liquid assets are things that you can readily turn into cash. So that's going to be money in the bank. They consider RRSPs to be liquid. Any investments you might have, tax-free savings accounts, that type of thing. So they'll look at those. You are allowed to have one house. They won't count the value. One car, they won't count the value. You can have a second car if somebody in the household is using it for work and the value is under $15,000. And then they're going to look at your household income, and it has to be below what Ontario Works would pay you in order for you to be eligible for the program. And then they want to know why you're applying to Ontario Works. So they want it to be somebody who just is in financial need because they can't look for a job. Maybe they're unable to work for a short period of time because they're having surgery, or maybe they're accessing Ontario Works until they're able to get approved for the Ontario Disability Support Program. So they're going to watch which caseload you're on just to ensure you fit into the program. So the amounts you get from Ontario Works are, difficult to see given, the cost of living these days. So you're looking at $733 a month for a single person, $1136 for a couple, and then it goes up if they have children. With Ontario Works, though that $733 or $1136 is made up of two components. One is basic needs, so seeing what you need to live on a day-to-day basis, and also a shelter amount. So recognizing, the need to pay rent or a mortgage. So it's got those two components in the payment. And then there are some extra benefits that you get from Ontario Works or can ask to get. So the wonderful thing you get with Ontario Works is a drug card, and that is going to help with prescription drug costs for drugs that are on Ontario's formulary. There are certain vision care benefits for dependent kids, eye exams for people ages 20 to 64. There's a special diet allowance, and I put asterisks beside this one because this is typically for somebody that's on Ontario Works. Typically, the first way I try to see if they might be able to get some additional funds from Ontario Works. So, special diet is an extra allowance given if you have certain named medical conditions for which you might require a special diet. So you might be able to get a little bit of money for for lactose intolerance or celiac disease, related to cancer if you have lost more than 5% of your body weight due to cancer treatment, high blood pressure, diabetes, high cholesterol, those type of things. So definitely something to look into. Your doctor fills out an application and it gets filed with Ontario Works. The other area that I try and get people some additional money from is for medical transportation. So if you have frequent appointments at the doctor, at a hospital, I would try and get you some transportation funding. So that could be the cost of a transit pass. If you have mobility issues, it might be a taxi chit system. And then you'll see other benefits might be available if you have diabetes, surgical supplies, things like that. So always worth, my theory with Ontario Works and with the Ontario Disability Support Program is ask. The worst thing the worker is going to say, no, we don't cover that, but it's always worth asking. So on to Ontario Disability. So this is the program that somebody is going to want to access if they're going to be, unable to work for an extended period of time. And again, you have to financially qualify for this program. Like Ontario Works, they're looking at your assets and your income, but they will let you have more than Ontario Works. And then once you pass the financial tests, then they're going to take a look at the illness. And as you'll see, the definition is they're looking for a substantial physical or mental impairment. It's got to be expected to last greater than 1 year. And it's got to have what they call an impact on daily living. So like CPP disability, they will also focus on your ability to work if that comes into play. But they will also look at things like your ability to attend to your own personal care or your ability to function in the community. So it's a more rounded test than just focusing on your ability to work. Ontario Disability pays more than Ontario Works, and these rates reflect the 5% increase that just came into effect this month. So you'll see a little bit more. So single person $1,227, a couple $1,838, and then a little bit more if it's a couple with one child. So just some examples of the rates. And then that same ability as with Ontario Works to get some additional benefits. So you get the same drug card with ODSP as with Ontario Works. You get some dental benefits covered, some vision care benefits as well. And then you can also apply for the special diet allowance if you have one of the named medical conditions. You can also apply for medical transportation, a little bit harder to get with ODSP than with Ontario Works. You just have to show more frequent trips to medical appointments. So again, that opportunity to get a little bit more in terms of benefits than just the check that you're getting. And then lastly, the workplace programs. And, with short-term and long-term disability, this is something that I could do, an entirely separate presentation on. So I talk very, very generally about it. You can always go on the Wellspring website if you want information on long-term disability. We have a video series, sort of the ABCs of long-term disability. So if that's something that applies to you, it would, it's a helpful video series. So short-term disability, again, this is something that you're going to look in your benefits booklet or employee handbook to see if it's available to you. And I put unique contract because your employer and the insurance company negotiate a contract, and each one can be very different than the next. So there's no sort of set short-term disability policy. They will have some general things about them that, are the same. Generally, they're going to pay anywhere from 60 to 100% of your pay. So again, you'll see very big range. And similarly, the range in how long you can collect short-term disability benefits can be quite long. So I've seen them for 6 weeks, and I've seen some that last as long as a year. With short-term disability, it may actually be paid, especially with large employers, it'll actually be paid by the employer. So it's going to look very much like a paycheck, and they're going to take deductions off it. And then sometimes it'll be paid by an insurance company. With long-term disability, that's something that's going to typically be only paid by an insurance company. And again, that's a unique contract between your employer and the insurance company. So, very few policies are going to look identical. When you're working and have long-term disability through your employer, that's a group plan. And with long-term disability, there's a waiting period or an elimination period, as they call it in the policy. And that's typically the length of time you have to wait before you can access those benefits. And that's typically going to be the length of your short-term disability or the length of your employment insurance sickness benefits. So that's, it's tied to some other type of benefit that you would be collected. It typically, there are some lump sum policies, but it typically pays a percentage of your salary. And again, I've seen a whole range of those or a formula as well. And depending on who pays the premiums for your long-term disability, it can be taxable or it can be tax-free. So in one of the questions that was given to me when people registered, somebody had asked about, the difficulty sometimes getting the insurance company to approve a claim, or if you're on claim, they may want you to return to work faster than you feel able to. And that's a tough one. The insurance company, they're trying to get you back to work. That's what they ultimately want to do. And what they're looking for in terms of the definition of disability for long-term disability is whether you're able to do the material duties of your own job. And if they feel that you're able to do some of them, they may put, either deny the claim, or if you're on claim, they may push you to do a return to work. And the best thing that you can do is work with your doctor, to advocate to either get onto long-term disability or to remain on long-term disability if you're already on. It's a tough one. Again, you're wanting to give the insurance company as much as you can in terms of subjective and objective medical information, examples of how your particular disability affects your being able to work and do the duties of your job. And then lastly, in terms of income replacement, we're focusing on personal resources. So again, these are going to be resources that are unique to each person. So again, depending on your financial situation, when you're dealing with your illness, you may have to dip into your savings. You may need to cash out your RRSPs. And, if you do that, there is withholding tax that you have to pay. You may have to sell a property. You may have to refinance a property. So again, these are, sort of difficult decisions. And somebody in the questions that were submitted with the registrations asked, about things like cashing in RRSPs, reverse mortgages, that type of thing. And the suitability of those types of options, like, again, cashing in your RRSP, selling property, refinancing your home, that type of thing, those are very, very dependent on your own sort of financial and life circumstances. And those are questions, therefore, that I always refer people to talk to their financial advisor or financial planner or an accountant, just to make sure that the decisions that are made are in alignment with what your particular situation is, what your plans for the future are, that type of thing. So that's my advice in that regard. And then always, see what insurance you might have through associations. What have you purchased privately? Sometimes when you sign up for a credit card or when you get your mortgage or a line of credit, you may have purchased disability insurance and you're paying monthly for it. So always do a double check to see if those might be available. And so those are your income replacement programs. Now, somebody had asked about programs that are available for somebody that's over age 65. So this is a tough one if you're continuing to work and then are dealing with an illness over age 65. Luckily, if you've been working and have contributed the requisite number of hours, you can go ahead and apply for employment insurance sickness benefits. But as we know, that's only 15 weeks. And unfortunately, Ontario Works, Ontario Disability, and CPP Disability are not available after age 65. Similarly, the bulk of long-term disability policies coverage will terminate at age 65. So the reason this is, you know, the government feels that because somebody is collecting old age security and CPP retirement, that those are sort of a replacement for the disability program. So somebody in that situation would be relying on their, after the EI finishes, on their CPP retirement and old age security, and can look into the possibility of supplementing their old age security with what we call the guaranteed income supplement. And so I'll just take you really quickly, just given, you know, we don't have a ton of time today, I'll take you really quickly through the seniors programs. So the very first thing everybody knows about, Canada Pension Plan has our retirement benefits program, and it's available. You can start it as early as age 60, and you can wait as long as to age 70. And again, it's a formula. So, and the amount you ultimately get is going to depend on how much and how long you've contributed. If you collect it between ages 60 to 64, there's going to be a penalty. So they are sort of encouraging people to wait till 65. And so as you'll see, it's adjusted downwards for each month or year under age 65 that you take it. And the current rates, the most you can get right now from CPP retirement is $12.53.59 a month. And then unrelated to your working, but still available to you based on years of residence in Canada, is old age security. And that's available from age 65 to 70. You can defer your old age security to age 70 or anywhere in between 65 and 70. And they'll give you a little bonus for hanging on a little bit to collect it. So again, that's something people can think about. Some people feel if it's available to them at age 65 and they're going to invest it or use it, they'll just take it at age 65. And then again, that's something you can speak to an accountant or a financial planner to find out if there would, you know, what the benefit would look like if you were to defer to age 70. And you can see maximum old age security is around just under $670, and it's higher. They increase the amount for those 75 and over, and so the maximum for that is $733.51. Old age security is income tested in a way, so if your income is above is above $80,000, they're going to claw back all or part of it, depending on how much over 79,845 it is. So then there's the guaranteed income supplement. So what the government will do if you apply is they will take a look at your income in the previous year. And if it's below a certain level, you may be entitled to a top up to your old age security, and that's what we call the guaranteed income supplement. And again, you'll see on the screen just you know, if it's somebody that's single, they'll be looking for their annual income to be less than $20,000. And when they look at that annual income, they don't count old age security. So it would be looking at your employment income and your CPP, private pension you might have. And again, if it's less than $20,000, there may be a supplement available to you, and there's paperwork that you would fill out. If you, right now they are looking at the guaranteed income supplement. If you had applied, they would look at your 2021 income. If your 22 income has really gone down because of your illness, you don't foresee being able to return to work, there's a special form that you can fill out to apply for the GIS and ask them to take a look at your estimated income for 2022 and see if you might qualify for the guaranteed income supplement. So that's something you also might want to look into if you didn't previously qualify. And then if you get the guaranteed income supplement, you'll see Ontario, and I'm sure the other provinces will give you an automatic top up. It's not a huge amount, but it's a small amount that would be automatically added to your check. It's called gains. And then lastly, so if you are 60 to 64, and your spouse or common law partner is getting the guaranteed income supplement, and your combined annual income is less than about $37,000, you can apply for the allowance, it's called, and that may result in a small top up to your income. And similarly, if you have a spouse who has passed away and your age is 60 to 64, and your annual income is less than $27,000, you may be able to apply for and collect what's called the allowance for the survivor. So again, with all of these programs, I'm just giving you little snippets of the eligibility requirements and what they pay. The government websites on these topics are actually quite good, and would give you a much more thorough introduction to these programs, and have all the application paperwork and that type of thing. So I'm going to flip now from sources of income and just talk a little bit about treatment-related expenses. And so the first area that I will start at is drug coverage. And I do this less and less now because many of the cancer centers and hospitals now have what they call drug navigators or medical reimbursement specialists. And so they really know all the ins and outs of drug coverage, but I'll just give you a little primer. Again, this is going to be, for the most part, Ontario focused. But again, you will find similar programming in your province. So in Ontario, we have our Ontario Drug Benefit Program, and I'll show you what that's comprised of. There are other prescription drug programs like through Cancer Care Ontario. We have the Ministry of Health has an exceptional access program. You may have drug coverage through a group benefit plan through your work, or maybe you've purchased private health insurance. And then a lot of the drug manufacturers will have compassionate access programs. So perhaps you have an insurance plan that doesn't cover all of the drug. You may be able to get some funding from the manufacturer of the drug itself. In terms of the specific programs, our sort of main public drug program is our Trillium drug program. And, people often say I'm not eligible for it. Anybody with an Ontario health card is eligible for Trillium. The question is really whether it's going to benefit you. So Trillium is really geared towards helping you if your drug costs are high relative to your household income. So what they have you spend a certain amount of money based on your household income on medication out of pocket. And when you hit what's called the deductible, then the government kicks in the rest. So again, anybody's eligible. It's just a question of whether it's going to benefit you. If you have a nurse coming into your home through what used to be the LHIN, now Home and Community Care Support Services, you might be entitled to a drug card. So not a personal support worker, not a home care worker. It's got to be a nurse. So that's one option. As I discussed with Ontario Works and ODSP, you get a drug card. Seniors, and this came up in one of the questions, seniors have access to a public drug program as well, and their drugs that are on Ontario's formulary are covered. If your income is above a certain threshold, it's just $100 deductible for the year. And then for young people, 24 and under, there is the OHIP Plus program for their drugs. The other way to try and save some money in terms of medical expenses is trying to find help with transportation costs. So if it's lung cancer you are dealing with, there is Wheels of Hope, which is the Canadian Cancer Society's program. It has two components. There's a volunteer driver program, but they also have a travel treatment fund. You can also look for the public paratransit service. So in Toronto, for example, that's Wheel-Trans. So that's if you're not able to drive and you need public transportation, they have paratransit services for people with mobility issues. Check into local community organizations. So for example, the Red Cross in certain areas has a transportation service and they charge a per kilometer rate. And also look into other community medical transportation services. So for example, in Toronto, we have iRide Plus. We have chats. So again, those are services where you're going to pay a per kilometer rate, but it's generally lower than having to take a taxi or an Uber. And then parking passes. So if you're going back and forth to the hospital and really do need to park, or a family member needs to park, they will all often offer multi passes that'll at least save you a little bit of money. They'll still be very expensive, but they'll save you a little bit of money. And then just some, miscellaneous help with medical expenses. So Ontario Works offers discretionary funding. So you don't have to be on Ontario Works. It's for those that have a one-time medical need that they just can't cover. So perhaps they're getting a scooter from the assistive devices program and they can't afford the 25% that they have to cover. This would be an opportunity where you would try and access discretionary funding through Ontario Works. So in Toronto, it's called the Hardship Fund. So you would just call your local municipality's Ontario Works office and see what their discretionary funding program is. As I mentioned, with the mobility device, we have our assistive devices program, and there are similar programs across Canada. And that's going to be where the government pays for a portion of, again, mobility devices. It could be diabetic supplies, respiratory equipment, home oxygen therapy, that type of thing. Accessible parking permits, again, don't necessarily save you money, but do give you more accessible parking. In some areas, I know in Toronto, you can park without putting money in a meter. Look carefully at the rules, but that might be a little cost-saving measure for you. If you need the help of a personal support worker and there's no one else that can help, you can self-refer to your LIN or home and care community support services to get somebody to come in to help with the bath or that type of thing. Again, limited resources, but you can always self-refer or refer through the hospital. If you need dental work done, see if your municipality has some sort of low-income dental program or specifically clinics. So, for example, University of Toronto has a lower-cost dental clinic that you can try. And I always tell people, pick up the phone and call 211 wherever you are, because they have a directory of all the community services. And for all you know, they're just might be something available in your neighborhood or area that can help. Like community organizations. So March of Dimes, they have their own assistive devices program. The Red Cross, as I mentioned, has a transportation service. Canadian Cancer Society, they have a great information service. They have a transportation. They have wigs, prosthetics. In certain provinces, they have accommodation. So take a look and see. You can access their website or give them a call. So always good to do a little Google search and see if there are any local community organizations that can be of help, again, with lending equipment, that type of thing. Medical expense tax credit. Again, I'm not a tax expert, but I'll give you a little snippet of why it's a good thing. So the medical expense tax credit it's what we call a non-refundable tax credit, which is a confusing concept. So basically what that means is The credit can't be used to increase the amount you're going to get from a refund or to create a tax refund when you wouldn't already have one. So in other words, your savings can't exceed the amount of money you owe, if that makes sense. So let's say on your tax return, you're eligible for a $500 medical expense tax credit, but you only owe $200 in tax. What it'll do is it's going to wipe out the 200, but that 300 excess it's non-refundable. So you're not going to get an extra 300. It's literally just going to take your tax bill down to zero. So it's just something to think about. And the medical expense tax credit, there's a great search function on the Canada Revenue Agency website where you can enter in the medical equipment and see if it's something that's eligible for the credit. So I've just given you some examples. Obviously, prescription drugs are eligible. Organic food isn't. One of the questions I'm asked all the time is, can I put my parking on my tax return? My understanding is you can only do that if you're traveling more than 80 kilometers each way to your medical services. So again, great website to look at just to get information. And then I did a couple of slides based on your questions. A couple of people had asked about the disability tax credit. So this is also what we call a non-refundable tax credit. So it can just bring your tax bill down to zero. It can't trigger an additional refund. And the disability tax credit has a very, very high threshold in terms of meeting the definition of disability. It is not tied to your ability to work like a CPP disability or an Ontario disability. As you can see here, the eligibility is you can be blind or markedly restricted in one basic activity of daily living, or significantly restricted in two or more, or need life-sustaining therapy. And in terms of the basic activities of daily living, so they're looking for you to be markedly or significantly restricted in your ability to speak or hear, walk, elimination, feeding, dressing, and mental functions. In terms of life-sustaining therapy, so it's got to be something that's needed to support a vital function. And you'll see oxygen therapy would be an example, chest physiotherapy. It's something you need to have at least 2 times a week, and it's got to be needed for an average of at least 14 hours per week. So just something to think about. And, what I tell people is don't sort of guess if you would or wouldn't qualify. Have a chat with your doctor, bring them, it's a disability tax credit certificate that they would fill out, and let them see if they feel you would be eligible for applying, rather than, it's hard to know. So again, have that talk with your doctor, bring them the disability tax credit, and you can discuss if they think you would qualify. The other thing I should mention, it's got to be something long-term. So they're looking for something that's going to last for a continuous period of at least 12 months and be present all or substantially all the time. So at least 90% of the time. So again, high threshold of disability, but let your doctor decide. Again, based on questions that came in, I'm just going to give you a quick little primer on insurance. So often asked, I'm no longer working. Can I get, sort of drug and dental coverage if I have a pre-existing condition, if I'm dealing with this medical condition? So the thing to do is just apply, talk to a number of different insurance companies, and you may very well, depending on your medical condition, have them say you're just not insurable. Or, as the case with certain types of cancer, you might become insurable after a number of years post full recovery. You may get what's called a rated policy. So they'll cover you, but you're going to pay a much higher premium, and there may be a number of exclusions applicable to the policy. And then what I found in my research for this presentation, which I hadn't seen before, these policies for health insurance, I'd seen them in the life insurance sector, but guaranteed issue policies. So it's policies where they do not ask medical questions, but then there are big, things pointed out on the website that you're going to be getting, there's going to be higher premiums to pay, and there will be caps on the coverage. So for example, they will only cover $2,000 of drugs in a year. So again, with insurance, speak to an expert, read the policy really carefully. For really good background information on insurance, the Canadian Life and Health Insurance Association has a great website. And similarly, if you're having trouble with an insurance company or can't get a straight answer, the Ombuds service for life and health insurance is a great, what they sort of view themselves as an impartial third party to ask questions. So another good thing to look at. And then the other thing is travel insurance with a pre-existing condition. And this is travel insurance that you may go purchase, or it's travel insurance that may be in your group policy at work. So it's going to have a pre-existing condition clause, meaning that if you have a medical condition that existed before you got covered, it's not going to pay for medical expenses related to that pre-existing condition if that condition was not stable in a specified period of time before the effective date. And that period of time can vary. It can be 3 months, it can be 1 year. I've seen both, and I've seen in between. And the definition of stable can also vary. So stable could mean you haven't had any new treatment, you haven't had a change in your medication, you haven't had any new symptoms. And I recently saw a travel insurance policy that had a specialized definition for a lung condition, and it was excluded if in that specified period you had to have treatment with oxygen or prednisone. So I found that interesting. So again, one of those situations: speak to an expert and read the fine print. And then lastly, and then we can get to your questions, just a little bit of some ideas for household expenses. So if your rent is in arrears, check with your social assistance provider, such as OW and ODSP in Ontario. They will have some sort of housing stabilization fund, so some fund available to help with overdue rent. Again, not a great situation in Ontario, at least with our subsidized housing, but there's long wait lists, but no harm in getting yourself on a wait list. And in Ontario, we have housing help centers that can help you apply and can also help you look for lower market rent units. A lot of municipalities will have something called a rent bank, where you can get a one-time interest-free loan if you're behind in your rent. Similarly, for utility arrears, again, the housing stabilization funds can help. In Ontario, we have a special energy assistance program for people with low income. We have our Ontario electricity support program, which if your income is below a certain level, they'll offer you a credit on your bill. Check for water bill relief programs. And similarly, you'll also find some property tax relief programs. It's not going to wipe out your property tax, but it may defer increases or cancel increases. So it's not, doesn't help with the actual bill, but may be that you're not subject to increases. Check out local food banks. There's a lot more food available, better food available now through them. So obviously worth checking into if you're having trouble with food costs, given the cost of groceries right now. And as I mentioned, the housing help centers. If you are struggling with debt or budgeting, that type of thing, credit counseling agencies are a really good source for just getting some suggestions and guidance regarding managing your debt. So credit counseling agencies are very different from trustees in bankruptcy. These are nonprofit agencies that help people, again, with things like budgeting and managing their debt. So just Google credit counseling and make sure it's a nonprofit agency. And similarly, look local information lines are. So 211 or 211ontario.ca. 311 will help you with finding government programs. Check for local community agencies, what they may offer. If you're having issues with Ontario Works or ODSP or needs certain types of legal assistance, check out your legal aid, community legal clinics if you're eligible. So other helpful resources. And then just added, I think, 1 or 2 extra slides, again, just based on questions that came in, help for caregivers. And that's a tough one, especially, I know that somebody had mentioned, what if you're a self-employed caregiver? So the 2 benefit programs available for caregivers are through employment insurance. So it anticipates somebody being an employee of a company contributing to EI. And there are the family caregiver and the compassionate care benefit programs. They are available to people that are self-employed, but you have to enroll in the program and you have to wait a year before you're eligible to make claims under it. So it might be worth looking into if you're self-employed, but again, you're going to pay premiums, but won't be able to make a claim for at least a year from your enrollment. There is a small non-refundable tax credit called the Canada Caregiver Credit, where if you are providing certain types of care to a family member, you might be eligible. So take a look and speak to an accountant about that. And I'll move to questions. You know, the only other question that I didn't I didn't create a slide on, just because it's a tough one, is just people that are here on visitors visas and accessing financial and other types of help. That's a tough one. With visitors visas, you're not eligible for Ontario Works or Ontario Disability. What I always suggest to people in that situation is to connect with their local, what they're called community health clinics. So if you just Google community health clinics, you can find your health clinic, and they will usually have types of support systems to at least get some information and some guidance. So that's typically the first step that I suggest to people, is connecting with the community health clinic. And I think that is it.
Thank you so much, Eileen. That's wonderful information.
Lots of information.
Lots of information, but very, very helpful. For all those who are wondering, a recording will be available after. So once that's been processed, we'll send an email to everyone so that you can access this again. But some questions that are in the Q&A. One asks, if you are currently on CPPD and your children are currently eligible for the dependent benefit, if you pass, do they continue to receive the benefits until 19 or 24 if they're a full-time student?
Great question. Yes, but it won't be, it'll switch to a surviving children's benefit. So they may actually make you reapply, but it's a different type of benefit. So instead of being the children's benefit of a disabled parent, it's the surviving children's benefit, but it's the same amount, and it's the same thing where you have to be either under 19 or under 19 to 20, 18 to 24, and in full-time school. So.
All right, that's great. And then I know you mentioned that people who currently have a nurse visit at home would qualify for a drug card. Does that include people who currently are receiving the LEAN, participants of the LEAN palliative care program?
Not necessarily, but if as part of their palliative care program, they have a nurse coming in to administer drugs or clean a wound or anything of that nature, or help with medical equipment, if it's a nurse coming in, it should be available, and you should definitely ask for that.
Okay, that's great. And another question here is asking, for CPPD or EI, are they dependent on the spouse's or partner's income as well?
I can happily say no. Those are the 2 programs where they will not look at your household income. Whereas, as you know, with Ontario Works and ODSP, absolutely, they're looking at household income. For CPP, disability, and EI, absolutely not.
Okay,
Yeah.
that's great. I think that's all we have for the Q&A. Any last thoughts before we end?
From my perspective, so, it's a lot of information that I put into, 50 minutes. So I really find over the years, the government websites have gotten better and better. And so it's sometimes hard to find, but I hope at least you'll get some keywords, from the presentation to help you on that search. And don't hesitate to reach out to me, if you have a cancer diagnosis. I'm always happy to answer questions through the Money Matters program at Wellspring.
That's great. Thank you so much, Eileen. And thank you everyone for participating today. Once the browser closes, you see a short survey. Please give us your feedback and also suggestions for any more topics that you want to learn about in the future. Have a good afternoon, everybody. Thank you.
Thank you very much, everyone.